If you've searched how to make your penis bigger and got buried in hype, this video gives you the science. You'll learn how to measure correctly, what counts as normal, the natural ways to enlarge penis that actually help performance, and the single evidence-based penis enlargement method for real, measurable length gains. Stick to the end. I'll reveal the safest path to increase length long-term and the exact plan to make it work. First, context helps your brain relax. When you measure properly, most men are already in the medical normal range. That doesn't mean you can't improve how you look, feel, and perform. It means you can stop chasing myths and start using methods that work. Accurate measuring. For length, use a ruler on top and press gently to the pubic bone, bone pressed length, from base to the tip of the glans. Do this erect or flaccid stretched. Pull straight, firmly, but not painfully. For girth, wrap a soft tape around the midshaft, not at the base or near the tip. Measure in a warm room, standing, take 2 or 3 readings, and average. Extra fat over the pubic bone can hide visible length. Losing it often makes more of the shaft visible without surgery. So what are natural ways to enlarge penis, or at least look and perform better without risky procedures? Start with the system that powers erections: blood flow, pelvic floor strength, sleep, and stress control. Daily walking, 8 to 10,000 steps, and 2 to 3 strength sessions per week improve nitric oxide pathways and arterial health. A short pelvic floor routine supports pressure and control, 10 quick contractions, 5 slow 5-second holds, and 5 full relaxations. Eat for vessels, beets, leafy greens, watermelon, olive oil, omega-3s, and cut back on nightly alcohol. Sleep 7 to 8 hours so nighttime erections, your quiet health meter, stay intact. These habits won't magically add inches, but they increase penis size naturally in the ways that matter for firmness, stamina, and confidence. Now the big question: how to increase penis length and girth beyond appearance and blood flow? Be careful with marketing. Pills and herbal enlargers lack quality evidence for permanent growth. Aggressive manual routines like Jelqing risk microtrauma and venous issues. Fillers, e.g., hyaluronic acid, can increase girth temporarily with a skilled physician, but they don't add true erect length and require maintenance. Permanent fillers and silicone are high risk. Cutting the suspensory ligament may increase flaccid hang but not erect length and can reduce stability. Implants treat severe ED. They are not a cosmetic length tool. So, what actually works for penis enlargement with real length change? Medical-grade penile traction therapy. Gentle, sustained tension stimulates collagen remodeling. Think orthodontic braces for tissue. In clinical studies, consistent traction, low, comfortable tension for multiple short sessions per day produces gradual, measurable gains in stretched and erect length over months. Typical outcomes are around 1 to 2 centimeters across 3 to 6+ months for adherent users, sometimes more with longer protocols. It's not flashy, but among non-surgical options, traction is the safest, most evidence-based way to make your penis bigger long-term. Here's a simple, safe plan. Weeks 1 to 2, baseline and blood flow. Take bone-pressed length and midshaft girth in a warm room. Start daily walking, 2 to 3 strength sessions weekly, and a 5 to 7-minute pelvic floor routine. Optional, a brief, low-pressure vacuum warm-up, 5 minutes, to encourage circulation. Temporary size only, not a growth method. Weeks 3 to 4, introduce traction. Select a medical-grade traction device with adjustable, low tension, and comfortable support. Begin with 30 to 60 minutes total per day in short blocks. No numbness, no sharp pain. Track time and comfort. Weeks 5 to 8. Build consistency. Work toward 2 to 3 hours total per day in divided sessions, e.g., 45 plus 45 plus 30 minutes. Remeasure every 1 to 2 weeks under identical conditions. Months 3 to 6, steady progress. Many users notice a clear bump in stretched length and a lower, fuller hang. Stay at comfortable tension. More force is not more growth. Some protocols go to 4 to 6 hours per day in chunks if lifestyle allows. Keep the blood flow habits. They support firmness and recovery. Safety rules. Traction should never cause numbness, discoloration, or persistent swelling. If it does, stop, lower tension, refit, and rest. If you use a vacuum device, avoid high pressures or long sessions that can bruise tissue. Filler decisions belong with a board-certified urologist or plastic surgeon. Avoid permanent fillers. Surgery is for specific medical indications, e.g., pyrones with deformity, not routine enlargement. Let's address how to increase penis length and girth visually without procedures. Reduce the pubic fat pad. This alone can reveal surprising visible length. Improve posture. Strong glutes and core tilt the pelvis favorably. Grooming at the base can make the shaft look longer. These are free, fast wins that pair well with traction. Do race or ethnicity determine size? Global data show small differences between population averages, but the overlap among groups is huge. Your individual health, measurement method, body composition, and adherence to training matter far more than ancestry. Don't let charts turn into stereotypes. Measure yourself correctly and follow the plan. Quick upgrades that boost results. Warm shower or heating pad for 3 to 5 minutes before sessions. Long, easy exhales to keep the nervous system calm. Track sessions with a simple calendar and give yourself a tiny reward after. What you reward, you repeat. Hydrate earlier in the day and taper fluids 2 hours before bed to reduce nighttime wake-ups. Magnesium-rich foods support relaxation and sleep. Discuss supplements with your clinician. So, if you're serious about how to make your penis bigger safely and predictably, focus on 3 pillars. Measure correctly, build blood flow and pelvic floor strength, and commit to penile traction therapy with low tension and high consistency for months. Expect gradual progress. Millimeters add up. Combine that with fat pad reduction and better posture, and the visible change is greater than the ruler suggests. That's the closest thing we have to reliable, non-surgical penis enlargement. If this helped, like, subscribe, and share so more men see facts instead of myths. Drop a comment with your single next step. And if you want guided pelvic floor work, timing, holds, recovery, to support firmness and control, check the pinned comment for a simple at-home trainer you can use 5 to 7 minutes a day. I'm an AI urology guide using publicly available research. This is educational information, not medical advice. Don't start, stop, or change any treatment based on a video. Talk with your own clinician for personal guidance.